So, my name is Brodie, and I'm one of the recruitment consultants rather, at Menlo Park. And I helped you get over to Ireland last year from the NHS to go and join NUA as a clinical director. And so what I've done is I've set the session so that I can have a discussion with you really about what your expectations were going into it, and indeed how you feel after having been there for a little while. So um, I'll give the floor to you.
Thank you so much, Brodie. So my name is Dr. Olajubu, and as you said, I'm currently the clinical director at NUA Healthcare Services. But previously and prior to this role, I was working as a consultant forensic psychiatrist and the interim director of medical education for a trust in NHS trust in Kent. Um, so what did I expect? Well, as you and I know, you approached me,
Mhm.
and I must say at the beginning I didn't have any expectations. I was just surprised that you reached out to me. But once you got the conversation going, what did I expect from you? Well, I expected some hand holding really because I'd never lived in Ireland, never considered working in Ireland. I obviously wanted clear information about the role that you were putting me forward to. Um, Once I got through and the expectations of the interview process, and then once I'd gone through the interview process and had been offered the job, um, you were very helpful actually in just helping me navigate the landscape between the transitioning from my NHS role into moving to Ireland and into newer.
Mhm. And so, in terms of, I'm not actually sure how much you dealt with recruitment consultancies before engaging with me, but in terms of what you expected, were you happy? Were you satisfied with what you got from us, from me?
I was more than satisfied. I was really grateful to you, Brodie, because you were very responsive. I think one thing that I think anybody who's making the leap would want or getting engaging with a recruitment agent is responsiveness. You're always at the end of the phone. Nothing was too much trouble for you. You were very patient in answering all my queries, and I had quite a lot. Um, and most importantly, you got the task done, and you were a very good link between myself and Newer in the early stages while I was still building my initial relationship with them.
Yeah, and I think that that's one of the things that recruitment consultancies can be best at, because even if you've agreed to join a company, even if you've agreed to become part of the family, until you actually are, there are often times, and this happens with clients all around the world, good ones, bad ones,
Mhm.
big ones, small ones, that onboarding can be a little clunky to begin with.
Mhm.
Um, so, are you glad that you've made the move?
Oh, I'm definitely glad. I was I think I said to you off camera a couple of days ago that I'm so glad that I made the leap. I'm feeling very fulfilled in my new role. I'm leading on a project which is hopefully going to make a big difference to the clinical forensic scene in Ireland. Um, I've had a lot of support from NUA since I joined, and I actually have a much better work-life balance. So
Yeah, I
win-win.
mean, and so in comparison to the NHS, what sort of work-life balance do you have? Or from where you were, say, 2 years ago, um, to where you are now? Of course, with the pandemic, I think any healthcare system was going to be extra pressure. But in terms of where you were with the NHS and where you are now, do you feel like you've got more or a better balance?
Well, of course, as you said, the pandemic put every clinician under pressure, and that was understandable. But even before the pandemic, I was typically working around the clock, and I typically was not having any work-life balance. And if anything, the pandemic made it worse. And of course, as a clinician, you want to be devoted to your job, and you want to work hard, and you want to provide patient-centered care and give the best to your patients and to the service that you work for. But you're going to be no good to anybody unless you're able to have time out for yourself. And at a point very much toward the last couple of years and pre the pandemic, my work-life balance seemed to disappear, and it just got worse within the pandemic and didn't improve as the pandemic began to ease off. So
Mhm.
yeah, from that perspective, if nothing else, actually, the move to Ireland has been fantastic. But beyond that, I'm really enjoying the opportunities that have been afforded me in Ireland in terms of career progression.
Good. Yeah, that was one of the things I think that I think, frankly, I had engaged you with near the beginning was
Mm.
that you had suggested you didn't have too much room for growth, or that you didn't see yourself, going any further in that organization, um, and so that gave you the ability to come to Ireland and actually have some more, have the career progression on the horizon. And do you feel that you've got that now?
I definitely do. I have to say that I worked for an excellent forensic service in Ireland in Kent, and we were deemed outstanding. And when you've worked with an outstanding trust, there isn't too much for you to go, especially since I got relatively near to the top. But
Hmm.
I felt like I reached a ceiling where I couldn't really go any further there. And because obviously, when you work for a place that's outstanding, nobody's moving anywhere. And I really
Hmm.
wanted to, I just felt the need for some more challenges and some more stretch in my career. So, and that's what this move has afforded me. I'm now working in, I'm working with a team to set up what will be the first low secure unit in Ireland. So, actually bigger than I even thought. It's a project that is being watched nationally. Um, it's exciting, it's innovative, and actually it's putting something back. It's developing something that's going to be very beneficial once it takes off to the nation of Ireland. So great for my career and great for my personal and professional fulfillment.
Good. I'm very, very glad to hear that. And so, in terms of how you feel supported, how do you feel supported at work now? And do you feel more supported or less supported after having made the move?
Well, as you know, during the transition, I think you were my primary link, and you did a lot of negotiating for me in terms of my contract, negotiating extra time in terms of my notice, which ultimately went on to be about 5 months, um, and just even giving me support in terms of negotiating with the company about accommodation.
Mhm.
Since I've got here, I found it to be a very supportive environment. I've had a lot of support from my line manager. I was allocated a property manager to help me navigate the landscape in terms of accommodation. Um, so yeah, it's been very a good process. And in the initial stages, obviously, while we were looking for accommodation, I was put up in a hotel at the cost of the organisation. So it's been
Mhm.
a win-win. Obviously, transitions are not easy, so of course there were lots of things I had to learn. But I think the most important thing to say was that I had the support both from yourself and also from the organisation, from NUA.
Yeah, yeah, and I think not all organisations, I think, are would have been willing, I think, to do some of the things that NUA did, and I'm very, very glad that they were able to do it.
Yeah.
So, um, okay, so my last question really is, what's life like in Ireland? When you're not at work, when you're not doing your clinical work, what is it like? What's the culture like?
Well, the Irish people are very friendly, and it's a bit of a novelty for me living, having lived between London and Kent. When I go for a walk, and people actually smile and they say hello. Um, I live in a very beautiful leafy area called Naas, and I love Naas because actually, it's very quick for me to get to the town centre and to a wide range of shops, but literally 5 minutes, I'm in the countryside. I actually live on a street where at the end of the street there's huge lakes and swans. It's very picturesque. So I think the first thing is that Ireland is very beautiful. There's a lot of countryside. It's very peaceful. Um, and there's actually lots to do. For example, sometimes at the weekend, I will go down to Dublin and explore. And there are lots of things further afield. So Ireland's a great place to live and to work. And as I said, for me personally, it's been great in terms of my work-life balance. And there's
Yeah,
everything you could find in England or Wales or wherever anybody's coming from, you'll find in Ireland. And because Ireland is not huge, actually, with some planning, there are lots of wonderful and interesting places to explore. And I've been
mhm.
doing that gradually. I've also had
Good.
family and friends come down as well, so to share the joys.
Okay. And so, if I could ask you what the one thing that has changed that you are most happy about, what would you say it is?
Can I be naughty and say two?
Of course you can. Yeah.
Well, I think the first thing I'm really happy about is the progression in my career and the opportunity to do something that actually is going to have an impact on the national health landscape. And I'm not exaggerating; it really will do, in terms of opening the first or leading and supporting to open the first low secure unit in Ireland standalone, because at the
Hmm.
moment they only have the Central Mental Hospital. And it's interesting and it's exciting because everybody's behind me, even the key players in terms of forensic psychiatry in Ireland are all behind and rooting for this project to kick off and to be successful. So that's really amazing, and that's probably point number one. But the second thing, as I've said throughout, is I'm also enjoying the fact that I personally have a much better work life balance. So it's not that I'm not working hard, but I'm not working round the clock. So yeah,
Yeah.
it's good
There's
for
a
me.
difference between working hard and being worked hard, I suppose.
Yeah, yeah,
I think that's something I've noticed, that you do seem a bit more relaxed
yeah.
over the last year or so.
Yes,
Well, and I wonder if you would, could you elaborate a little bit on the forensic aspect of what you just said? I suppose it's worth saying that you have faced a couple of challenges with the Irish Medical Council and registration, um, which is part of the issue, but it's part of the opportunity for you, I think. With the people that I hope to bring on, that problem probably won't occur.
mhm,
And I'd be happy to any people that are watching this, I'll explain it in more detail who do
mhm.
want to know what challenges they might face. But could you explain that challenge, or rather that opportunity, to me?
Okay, so forensic psychiatry is not as well developed in Ireland as it is in the United Kingdom, and it's ironic because actually forensic psychiatry started in the British Isles, actually in Ireland in the 1800s. But research and the evidence shows that actually, in terms of beds, Ireland comes probably third from the bottom when you look at Europe as a landscape. So the good thing is that as a forensic psychiatrist, if you're coming in, then you have a really great opportunity to make a real difference. Um, they've had a number of government initiatives where they've highlighted actually the need for the development of psychiatric services in Ireland as a whole, and definitely forensic psychiatry services, because at the moment there's just one secure hospital that serves the whole country. And even though they're moving to a new site in the next couple of months, it's already widely identified that it's not enough. So, as a forensic psychiatrist, if you're coming to Ireland, you have a real chance to make a real difference and to pioneer positive change for medical services and psychiatric services in Ireland. And I think that any clinician um, would love to have the opportunity to do something that's going to have an impact, a real impact on the national landscape. So yeah, um, some of the challenges. Okay, so in Ireland they don't have a specialist registered forensic psychiatrist, so you are going to have to jump through a few more extra hoops to get on the specialist register. But it is doable. So I guess
Hmm.
it's just to bear that in mind that it's possibly probably going to take you a little bit longer to register, get yourself on the register, just because there isn't a forensic specialist register in Ireland, and so
Hmm.
therefore you have to be able to demonstrate that you have in a wider way that you've got the capabilities um, as a consultant. But as any forensic psychiatrist would know, actually we give second opinions to general adult psychiatrists. In fact, psychiatrists across the domain, because we are the go-to people in terms of risk. So
Hmm.
you are going to have that evidence. But you just have to bear that in mind that you need to be ready to pull together your portfolio. But for any consultant, you would have been doing annual appraisals, and it's just a case of really pulling the evidence together and being a little bit patient.
Yeah, and I think that's what I mean when I say it's part of the challenge, but also part of the opportunity.
Hmm.
The very reason that you're there is to try and improve sort of the forensic psychiatric scene.
Yes.
And one of the problems with that is um, that as a consultant forensic psychiatrist, UK trained with a CCT, um, you would expect that perhaps it would be easier to get licensed. But again, it is as much of a challenge as it is an opportunity, because if you
Mm,
when you do go over, you
mm.
are indeed what was the term I used when we spoke a couple of months ago? I think I said trailblazing,
Yes.
because although there are challenges with getting licensed in Ireland, once you are there, you are literally trailblazing. There are no secure facilities other than the one the government has and the one that you're working on.
Yes.
So, um, okay. Well, thank you very, very much indeed for taking the time to have that discussion with me. I do hope that we get the opportunity to have more. And so, what I hope to do is get to work in having a couple of psychiatrists over to you in the next, 5 or 6 months. I think that's what we discussed, and we'll try and get that done for the opening of the facility. And what was the date, or what was the date that'd been penciled in? I'm not going to hold you to anything, but just
Um,
so that people are
the
aware.
unit is planning to go live at the beginning of July, and we would ideally want the consultant forensic psychiatrist to join the team a couple of months before, because of
Mhm,
course, even though at the moment the project is not live in terms of, we're doing a lot of work behind the scenes in terms of, all the behind the scenes things that you have to do when you're starting a new unit in terms of registration, etc. So it's a great opportunity, because anybody who comes now would also be very integral in helping to start up the service.
mhm,
It looks great on the CV. It's a great opportunity. And so it's a great opportunity for somebody who's a clinical leader as well, because you're definitely going to use your clinical leadership skills.